So in today's video, I'm going to talk a little bit about the first steps that you can take in getting help for your fibroids. First, if you haven't already subscribed to our YouTube channel, I strongly recommend that you do that. If you're on YouTube, just click on the link that says subscribe, or you can click on the bottom of our video here, and that should get you subscribed as well. I don't want you to miss any of the videos that we're putting together over the coming weeks. So for women that are having symptoms of fibroids, the first thing is to contact your doctor. And I know that sounds like a simple statement, but there's so many women that come see me in my office, and I say, how long have you been, suffering with these symptoms? And they'll say, a year. They'll say 3 years or 5 years, or some women even longer than that. As we talked about in our video a week or so ago, heavy bleeding, a lot of women think that it's normal. But it's not. If you're changing the pad every 30 minutes or every hour, sometimes even every 2 hours, and that's going on for days and days, then that's a lot. You can Google the exact amounts, but there is certainly some limit when you're bleeding that much. Some of the women that we see come in, they'll say they've gotten blood transfusions in the emergency room, and they still didn't go get treatment because, again, they just thought that it was normal. So the first step is seeking help. And obviously you watching the video here and on our YouTube channel and our website is a great first step in getting information. And I think that's probably, even before your doctor's visit, it's good to know some of your options and some of the background information before you get there. As unfortunately, even myself, we're all very busy. Insurances pay less. They obviously require us to see a lot more patients, and that unfortunately translates into seeing each patient for less amount of time. So, we probably can't spend sometimes as much time with each patient as we would like to. So, we do our best, and certainly in our office, we give our patients as much time as we possibly can. But overall, when you're going to see a primary doctor, and a lot of gynecologists are, acting as primary doctors, they have to see a lot of patients. So getting a good background is very important. So first step, contact your doctor, learn a little bit about the things that you're going to discuss by watching our videos or going to our website. Your doctor is probably going to potentially order a test, and that test is most likely going to be an ultrasound. Ultrasound's sort of the first step in diagnosing fibroids. It's usually fairly quick and easy, obviously non-invasive. It doesn't require any IVs. So ultrasound is certainly probably the most commonly prescribed test that we use to diagnose fibroids. More rarely, an MRI might be needed. Again, that's a little bit less common, but there are some women who will order an MRI even after we have an ultrasound. But that may be something that you get down the road after you've already decided that you're going to look at getting treatment. So again, I know, again, simple, but the first step, educate yourself on different treatment options, and then call your doctor. Again, some of the symptoms that we've discussed before are not normal. So at that visit, most likely you'll get an ultrasound. We actually do have an ultrasound screening program for patients of ours. So, if you don't have a doctor yet and you want to take that first step, then certainly you can contact our office. We often can set up a phone consultation with you between myself and you, discuss your symptoms, and then get you a fibroid screening ultrasound so that you can get a look at your fibroids. So hopefully this helps. Again, if you haven't subscribed, we hope that we're providing good information for you. So subscribe now, and we look forward to getting you more videos in the near future.